Hello, everybody out there. Thank you very much for joining us this evening. We have North Bend resident and longtime 10-year associate with healthcare joining us today to present on for small businesses of some of the trends, some of the things you should be looking for, and how his industry has been working. Currently, we have Matt Childs on the webinar with us, and I would like to turn this webinar right over to him. Matt, thank you very much for your time.
Thanks so much, Thomas. Appreciate being here, and love this Squawk Chamber and love the relationship that we have here. But let me share my screen, and that way we can get started with a presentation here. Talking about healthcare today, healthcare for small businesses. And so I wanted to just touch on some highlights of the industry, and then we'll get into kind of how small business can be served here in the state of Washington. But you can see my information is there on the screen. So again, if you have any questions about this, feel free to contact me directly via phone or email. Let's get into this here. And so a little bit about Business Health Trust, as we're getting going here. But one of the things that we're going to talk about is being able to have power numbers, and so making sure that small businesses, if you have 2 people in your company, or 20 or 200, that's great. You're not the size of Amazon, you're not the size of Microsoft, so you're not going to get the same effective rates as they are. But when we pull together thousands of small businesses, now we're looking at some better rates and coverages, and more so that you can find on the open market. So that's one thing we'll talk about today. And then the other thing unique that really happened at the beginning of last year, 2022, is that one-person companies now have an option for group benefits, which is fantastic. So we'll get into that as well. But one thing a few things I want to talk about are just what we're seeing kind of towards the tail end of 2022, and then going into 2023, just some of the trends that we're seeing. A few of them, self-employment, which is a rising trend, whether it be leaving your primary source of business and starting something new, or just having a side gig, talking about people moving and being a geographically disparate workforce, the virtual care trends, and making sure that people know about those. And then obviously we'll talk about costs, as unfortunately that's always on the rise. But from a trend perspective, what we're seeing, and there's a lot of studies out there, but there's about a 10% increase of folks who are starting their own businesses, kind of from a study a few years ago. This is actually a prior to current through pandemic resource here. So look at prior to pandemic, and then really in the pandemic is that 36% of employed surveyed respondents now they're doing some independent contracting work, or potentially even an own business. And what we're seeing is, even in the state of Washington, the graph on the screen is showing the number of business formations here in Washington state. And we're looking over time from 2004 to present day, 2022. And you can see towards the, through the pandemic, 2020, 2021, and now 2022, the sheer steep rise of the number of business formations. And so 44% year-over-year trend for right now. And what we're seeing is a strong professional services industry, strong retail, which includes the online retail. Then what we're seeing is it's a lot of 1- and 2-person companies. And so what do you do when you leave your job, leave your corporate job, or leave your manufacturing job and try to start something new? What do you do for healthcare? And so that's really the question that we're trying to answer today. Looking at a geographically disparate workforce, as we all know, and as we all have heard, that the movement towards remote work is a thing. We are obviously on a Zoom call as a result of this, as opposed to in person. And so it is a good thing. It is flexible and convenient in a lot of ways. But that does translate to people are not in the office, and people are maybe not even in Washington state. So depending on study, 20 to 35% of all U.S. jobs are fully remote nowadays. And so that's a big number, and it's a sharp increase from what we've previously been experiencing over the last couple of decades. Again, 3 to 10x from a prior to right before pandemic perspective. So this is not a regional thing. This is not an Issaquah thing. This is a national trend, but it does affect you potentially as you are potentially hiring labor forces that may not be in the Issaquah area. It may not even be in the state of Washington, just depending on their roles. Again, from a small business perspective, the war on talent is real. So when you're talking about where do you source and where do you find new talent, new employees? Benefits is a big component of that. When you're looking at who's looking at it, 53% of all small businesses, which is my guess is if you're watching this, you are considered a small business. More than half is looking at benefits being a predominant planning factor when they're looking at talent. And then when you jump upstream and go to large businesses, 70% are looking at benefits. So if you are competing against those larger F1000 type companies, Fortune 1000 type companies, they're already ahead of the curve on this. They're trying to increase their benefits to grab the best and brightest, which is funneling downhill to small business, and we're trying to do the same. So what does that look like? How do you do that? And what things can you do as a small business owner or in the small business industry to combat these rising trends here? Another thing we're seeing is virtual care and the increase of usage and utilization. And so if you're not familiar, virtual care is a thing. You can go to your primary care or a primary care on your phone, on your tablet, on your computer, 10 o'clock at night, and get prescribed prescriptions if you need it, or get help if you need it. Again, you're not going to see a physical therapist necessarily over the phone, but if you have the flu or if you're sick, it takes about 2 hours to go in and out of a primary care's office. And so you can save some time and do it from the comfort of your own home when it is convenient for you. So just from a FYI perspective, look at your current health plan. You should have a virtual care component in that. And so please use it just from a personal level. Please use virtual care because it is a fantastic option to be convenient for you. And you can see some of the rising trends and stats out there on the screen as well. And lastly, we're talking about cost, unfortunately. And so what I have there on the screen is 8.18%. And so what that number is the individual market here in the state of Washington. That is the number that if you have a ACA compliant plan, if you go to the Washington Healthcare Exchange, the average increase for 2022, 2023, this January renewal season, the average increase is 8.18%. So it means a lot of different things. If you are currently on the health exchange, you may have experienced something around this number, maybe lower, but likely higher, this being the average. It also goes to show for your employee perspective, they are experiencing the same thing. So if you do not currently offer benefits, where are your employees getting their benefits from? And likely it's from the health exchange. And this is something that they are experiencing as well. So how do you help them? How do you create a culture within your business to combat rising healthcare costs? Well, one way is to offer group benefits. And so this 8.18% number should be reduced when you do tap into those group options. And so that's one thing that we at Business Health Trust, organization that I'm with, we can also obviously help with. But again, a couple of reasons on the screen there are COVID-19, something over the actual cost realization by the carriers is now only being realized. And so a lot of people don't realize that healthcare actually is backwards looking and it takes them a long time to catch up. So the rising healthcare costs being 8.18% is actually because they are looking at 2020 numbers right now. They are looking at 2021 numbers right now. They're not forward looking. Healthcare, that's not how healthcare works. They don't project and look out to 2023. They use backwards data to then project forward. And so really what they're looking for is the 12 to 18 month look back to then project forward for their rates. And in this case, it's going to be that higher than normal increase. And 8.18% is the highest in 5 years that we've seen, and the highest increase that we've seen in the last 5 years, and the second highest in the last 10 years. So this is an abnormal year from what we're seeing here. Okay. All right, so that's the landscape. That's kind of what we're seeing from a 2022 perspective heading into 2023. And so why is Business Health Trust, the organization that I'm with, different? How can we help? How can we serve? And so we want to get into that. First of all, I alluded to it before, but we can help one-person companies. And so if you are a sole proprietor, if you have incorporated as an LLC counts, if you have incorporated your business here in the state of Washington, and you are giving yourself a W-2 for your wages, then you qualify for group benefits. If you are incorporated as an LLC, but you're just taking the distributions out of the business, that is not a qualifying factor. Okay, so you wouldn't qualify for group benefits there. But if you do give yourself that W-2, that's kind of the trigger here. That you qualify for group benefits and likely would get a better rate than what you can find on the Washington Health Exchange. So something to keep in mind as you're moving forward. And then obviously as you grow, if you get 2 employees or more, options become more available as you grow. Again, I alluded to this before. We at Business Health Trust link your businesses together to get that better coverage and better rates. And so what that means is we have thousands of employers and tens of thousands of employees as a result of that. And then we go to the carriers, and in our case, it's Kaiser and Kaiser Permanente and Premera for the medical, Delta Dental for dental, and VSP for vision. And then we go to them and say, hey, look at us. We look a lot like Amazon because of all these small businesses and small employers. Let's give us better rates and coverage. And so that's one of the motivating factors by working with an association health plan like Business Health Trust, because the rates that you'll see by going, if you just call Premera on the phone, those rates are going to be different from the rates that we can give you. And likely those rates are going to be on the higher end of things. We love the partnership that Issaquah Chamber and Seattle, or excuse me, the Business Health Trust has. And so this is how we operate. 25, 30 years ago when Business Health Trust started, we had to attach ourselves, it's a state requirement to attach ourselves to an association. And so we work through the chamber networks across the state to be able to do that. So this is a fantastic relationship, and I'm glad you found us through Issaquah Chamber. And so we really have only 2 requirements to get Business Health Trust members and membership. 1, you pay your bill, and 2, you join your local chamber. So if you're already watching this and you're already an Issaquah Chamber member, you've already satisfied those requirements. And if you are not a chamber member of Issaquah Chamber and are not interested in this, talk to the Issaquah Chamber team, get signed up, get your membership. You should probably do that anyway, but get signed up and ask more questions, because that will give you access to our benefits. And so it's a nice partnership that we can offer a symbiotic relationship. Again, talking about Business Health Trust and what we offer from a medical perspective, Premera Blue Cross and Kaiser Permanente, both at a regional and national level. We talked about that desperate workforce that we talked about earlier. So we do have a national reach as needed. And then we have VSP and Delta Dental for your vision and dental needs. Our employee assistance program is through behavioral health systems. And so I'll talk about that later. We also offer just other things such as personal accident insurance and life insurance and long-term care insurance policies. And so there's kind of a one-stop shop for all your health and benefits needs. And so happy to chat as needed. We're also here for employers. And so during, as the pandemic started to kick off in early 2020, one of the things we were able to do, just because of our relationships and our size and our sourcing, is we were able to tap into our network and be able to purchase and receive and then give away for free millions of masks, tens of thousands of bottles of hand sanitizer, thousands of hand sanitizer stations, and just pallets upon pallets of disinfectant and wipes and PPE. Because at that time, if you remember, that was a requirement to stay open, was to have certain PPE and requirements inside your in-person business. And so again, we care about our employees, and care about our employers. We want to make sure that you are able to get the resources that you need. And so many times we find what is needed, we give it away for free, because if you're in business, that makes the economy great. And honestly, we can stay in business as well. A couple other things we've done here lately. Remember when PPP loans and ERTC loans were in full force last year and a couple of years ago? We paid for consultant fees. We want to make sure that you had access, because it was a little bit confusing to get those resources. So we actually paid for CPA consulting fees to be able to get you set up and apply for those loans if appropriate for your business. And so again, we're always looking for ways to serve. We're always looking for ways to help small business in the state of Washington, because we only work in the state of Washington. Again, at the time as well, we were running vaccination clinics. And so we ran, I think it was 35 vaccination clinics over the time that those were, from a privatized perspective, were happening. And so again, always looking for ways to be able to serve. So obviously we talked about health benefits, and that's one major influencer. But again, once you get that chamber membership through the Issaquah Chamber, and then get access to BHT, Business Health Trust, and you start using our benefits, you also have tangential benefits that are for free, to include ArchBright, which is here on the screen. If you're not familiar, ArchBright is a company based out of Seattle. It's an outsourced HR company. So if you're a small business, maybe 2, 5, 10 people, likely you're going to have multiple hats, and likely HR is probably not your strong suit. And if it is, good on you. But for a lot of small business owners, it is not. And so what we've done is ArchBright has a lot of paid programs, but what we've done is from each level of their paid program, we've selected a few services. We've created a custom toolkit with those services, and then we give that custom toolkit away for free to our members. One thing to note is a couple of things on ArchBright is one, they have a resource that you can download thousands of templates for anything really HR related. So if you need an attendance policy, if you need an FMLA policy, if you need a performance review template, you can download for free, slap your logo on it. Lawyers have already reviewed these, so they're from a legal compliant perspective, and you can use them right away, or you can modify them as needed. The second thing is ArchBright has a hotline. And so if you have an HR question, if you need to know the latest and greatest on FMLA standards, or what's happening as far as 2023 Washington regulations, call the number, say you're a BHT employer, and talk to a human and ask whatever HR question you have. They have hundreds of HR professionals. Get them on the phone, and if they can't answer it, they get a lawyer on the phone to talk about it. So, and it's all for free. So something to consider, again, as a free benefit when you get health benefits. Employee assistance programs are, I'll put it in vogue lately, which is a good thing. Employee assistance programs historically have been only about mental wellness, which is a key factor and a huge need in our society today. Ours is that and more. And so if you think about really anything on the personal side, mental wellness, parent-child coaching, marital counseling, financial advice, anything really on the personal side, this is a free service to you. You call the number, you get a human on the phone, and what is nice, and let's just use mental wellness as an example, you get a human on the phone and say, I want to see a mental wellness counselor. They will ask you what insurance are you through, and you'll tell them. Then they will look in their system to see who is a in-network provider. They'll get you linked up with one or a few providers as your request. You'll start services, and those first 4 meetings will be for free. And then when your 5th meeting comes, then they will start to bill through insurance. And our behavioral health systems team takes care of that, and you don't even have to do anything. The nice thing is, if you have family members on the plan, if they have the same medical plan that you're on through your employer, they also get 4 free free visits as well. So it's a nice, fantastic program that is not just mental wellness. It's where it started, but it's all things on a personal level. So it's just something to be aware of that's out there. And if you are an employer who doesn't offer an employee assistance program, something to consider. Happy to chat about our program and just give you ideas of where to go. And lastly, one other free resource that we give to every single employee in your organization, regardless of if they have medical insurance or not, is the Passport Corporate Card. If you're not familiar with this card, it's actually started out at Microsoft about 30 years ago, but now it's an international company. It's kind of like Groupon on steroids. Usually you pay for the membership, but we give it away for free if you're a BHT member to all your employees. So what you do is you download the app, log in, and you can find all kinds of discounts and buy one, get one frees for concierge and travel and retail and just about anything you can think of. So again, fantastic program, the Passport Corporate Card. And again, that's for free to each one of your members, each one of your employees. So if this sounds interesting to you, if you do need access or want to chat about health benefits, because that is a great need, here's some information for you. Again, quote at businesshealthtrust.com, or my email again is matt@businesshealthtrust.com. We may need a few documents if you currently offer health benefits. So if you just want to baseline what you currently have and make sure you're getting a good price, happy to do that for you. We do it all the time. It's free, and just happy to chat. But if you have never offered health benefits before, it's probably good just to understand the cost of it. So that way you can budget maybe for later this year for 2024 when you are ready to offer benefits to your employees. And again, you can start group benefits at any time. So you don't have to wait till January 1st. If you want to start in March, you can start. And then lastly, thanks again. I want to make sure this is short and sweet and to the point. But thanks for watching. Again, my contact information is on the screen. Again, I'm Matt Childs with Business Health Trust. And so for now, I'll turn it over for questions.
Great job, Matt. Thank you very much for that valuable bit of information. I mean, it's truly and literally life-saving. We did get a couple questions in. First one, are there healthcare packages available that allow an employer to tailor the plan to accommodate remote workers?
Yeah, great question. So again, we talked about remote work already and how that is a factor in moving forward. So what happens with our plans are you actually tap into a regional network and you tap into a national network. And so those national networks are ones you've already heard about, which is Blue Cross Blue Shield and First Choice Networks. So it just depends on which plan you have. So yes, you can tailor it to remote workforce. And so if you are looking to hire in Florida or Texas or wherever, let's have a conversation to make sure that our plans make sense, because a lot of times they do.
Fantastic, fantastic. And the last question we got through is, will an economic downturn affect the projected 8.18% increase? And if so, how much should a small business owner expect?
Yeah, that's a great question. If I had a crystal ball, I would love to be able to tell that. And I'd probably go to Vegas on it as well. It's hard to tell about that, but what we can say is this. One, I always tell folks, budget 10% every year for increase of health benefits. At least on our end, we always do our best to keep it in the single digits, and in fact on the low end of the single digits. But every once in a while, it depends on the business and depends on your demographics. You may have a rising cost specific to you that is higher than that 10% mark, but usually that's a good number, and usually we can beat that number year over year. So that's one. Secondly, about the economic downturn, unfortunately, healthcare costs are less reliant on economic downturn and more reliant on what's going on in the hospital and facility systems. And so again, COVID and obviously affected the economics of the U.S., but it increased the increase of utilization for the healthcare systems. And so, we're seeing the healthcare rise costs, even though economic was a downturn over the last couple of years until recently. So hard to tell that, but what I always say is, budget for about 10%, and hopefully, plan for the worst, hope for the best, is what we always say.
Makes sense to me, Matt. Thank you very much for your time. Again, I really appreciate it. To everybody listening in, please share this link. You could not pass on more valuable information.